My name is Kelly Powers, and I'm going to provide an overview of SOTL-funded research conducted by myself and colleague Wendy Neustrup. We examined multi-patient simulations using telehealth to create opportunities for baccalaureate nursing students to experience and practice interprofessional collaboration. Effective collaboration is paramount to providing safe care. Nurses must be able to collaborate with those from other disciplines. However, in clinical settings, nursing students are often observers of team collaboration and do not get to actively participate. Therefore, we sought to provide collaboration experience via simulation, which uses realistic scenarios to mimic actual practice. A review of the literature showed that simulation can provide helpful practice with interprofessional collaboration. However, there are barriers to bringing various disciplines together in the simulation lab. In our own preliminary planning, we too face barriers such as scheduling conflicts. Therefore, we use telehealth to virtually bring other disciplines to our nursing students in the lab. There was a lack of research evidence on this strategy. We used a mixed methods approach to examine telehealth-enhanced, multi-patient, standardized patient simulations to provide experiential practice with interprofessional collaboration. A one-group pre- and post-test design was used with a phenomenological approach to evaluate data from focus group interviews. We gained a convenient sample of 44 BSN students in their final semester. The simulations occurred in the School of Nursing Simulation Lab in a room that has multiple beds similar to what you would find in a hospital unit. Surveys occurred in Qualtrics and focus groups were conducted on campus. The intervention was 2 simulation days that were designed and built into the final BSN clinical course. Learning objectives included identifying the need for collaboration with other members of the healthcare team and then communicating pertinent patient concerns to them. We gained a sample of 44 final semester BSN students. The simulations occurred in the School of Nursing Simulation Lab in a room that has multiple beds similar to what you would find on a hospital unit. Surveys occurred in Qualtrics and focus groups were conducted on campus. The intervention was 2 simulation days that were designed and built into the final BSN clinical course. Learning objectives included identifying the need for collaboration with other members of the healthcare team and then collaborating pertinent patient concerns to them. Instead of requiring other disciplines to be in the lab, students used iPads to see and communicate with respiratory therapy, social work, and nurse practitioner colleagues who were off-site. On the first simulation day, students communicated with a respiratory therapist because a patient had breathing issues. They also communicated with a nurse practitioner about another patient who had a high blood glucose level. On the second simulation day, they communicated with a social worker to prepare a patient with tuberculosis for discharge, and then spoke with a nurse practitioner about a patient who had suffered a stroke. Additionally, students gained experience communicating with patients as we utilized standardized patients, which are trained actors. Student groups rotated to these simulations throughout the semester, and survey data was collected at the start and end of the semester. We assessed self-reported collaborative competencies using the 20-item ICAS. We also created 3 items to assess the number of times students collaborated with someone other than a nurse in actual clinical settings. We asked them to report the number of times in the prior 3 semesters on the pre-test and the number of times during their final semester on the post-test. Data was analyzed using t-tests. For the qualitative component, 27 students volunteered to participate in focus groups that used an 8-question interview guide. Analysis used Georgie's methods. There were statistically significant improvements in all 5 ICAS subscales and the total scale mean score. There were also statistically significant improvements in all 3 items measuring amount of collaboration in actual clinical settings. Analysis of focus group data revealed 5 themes. First, Anxiety due to lack of experience. Students reported feeling anxious to collaborate. The simulations helped them overcome their fears. The second theme was improved clinical reasoning. Students discussed various aspects of the simulation that were helpful in improving their critical thinking abilities. Number 3, real-world practice. Realism of the simulations was maximized by working with the standardized patients and communicating with authentic professionals using telehealth. The fourth theme was how to communicate effectively. Students appreciated being able to practice interprofessional communication and get feedback. And lastly, application to clinical practice. Students felt the simulations helped prepare them for professional practice. They discussed examples of having used the lessons from the simulations while in their final clinical course. The ICAS total scale mean score increased to 4.16 to correspond with perceived ability to collaborate as being very good prior to the students graduating and entering practice. The significant improvements in the 3 items to assess amount of clinical collaboration was an important finding, as more than 80% of the students never or only 1 to 2 times had provided report or reported a patient concern in the prior 3 semesters. Not only did the simulations provide experience with collaborating, but the qualitative themes indicated that gaining such experience helped promote confidence and initiative to actually collaborate in clinical practice. Our findings support using collaborative simulations to provide experience working with other members of the healthcare team. We recommend using telehealth to help overcome any barriers there are to implementing collaborative simulations. The simulations remain in place within the BSN curriculum. A key factor in this success was forming strong relationships with colleagues in other UNC Charlotte schools and departments. Our findings have been published in the Journal of Interprofessional Care and the Journal of Professional Nursing.